Hello and welcome. Today we're diving deep into a condition that affects the kidney's renal artery stenosis. Join us as we explore what it is, what causes it, how it's diagnosed, treated, and more. Renal artery stenosis, at its core, is the narrowing of one or both of the arteries that carry blood to your kidneys, the renal arteries. The most common culprit behind this narrowing is atherosclerosis, often referred to as hardening of the arteries. This is where plaque, composed of cholesterol, fat, and other substances, builds up inside the artery walls, gradually reducing blood flow. Another less frequent cause is fibromuscular dysplasia, or FMD. This condition involves abnormal cell growth in the artery walls, leading to narrowing, beating, and even aneurysms. MD is more common in young women. Let's understand what happens when a renal artery narrows. When blood flow to the kidney is reduced, the kidney perceives a drop in blood pressure. In response, it releases renin, an enzyme that kicks off a chain reaction. Renin leads to the production of angiotensin CE, a powerful vasoconstrictor, meaning it narrows blood vessels throughout the body. Angiotensin II also stimulates the release of aldosterone, a hormone that causes the kidneys to retain sodium and water. This entire process leads to an increase in blood volume and blood pressure, often resulting in hypertension. Prolonged reduced blood flow can also damage the kidney tissue, leading to ischemic nephropathy, which is kidney damage due to insufficient blood supply. Over time, this can impair kidney function and even lead to kidney failure. Renal artery stenosis affects approximately 1 to 5% of the general population. However, its prevalence is much higher, potentially up to 20% individuals uncontrolled high blood pressure or those with chronic kidney disease. Atherosclerotic renal artery stenosis typically affects older individuals, often those with a history of smoking, diabetes, high cholesterol, or other risk factors for cardiovascular disease. On the other hand, fibromuscular dysplasia related stenosis is more prevalent in younger individuals, particularly women usually diagnosed between the ages of 30 and 50. The signs and symptoms of renal artery stenosis can be subtle and often go unnoticed until the condition becomes more advanced. High blood pressure that is difficult to control, especially in younger individuals or those who previously had normal blood pressure, is a primary clue. Some patients may experience worsening kidney function, leading to symptoms like swelling in the legs and ankles, fatigue, loss of appetite, and changes in urination. In severe cases, particularly with bilateral stenosis, meaning stenosis in both renal arteries, patients might experience acute kidney injury or even kidney failure. Sometimes a bruit, an abnormal sound, can be heard over the abdomen during a physical exam, although this finding is not always present. Diagnosing renal artery stenosis involves a combination of imaging tests and blood tests. A renal artery ultrasound with Doppler can assess blood flow velocity in the renal arteries. A CT angiography or MR angiography provides detailed images of the renal arteries, allowing doctors to visualize any narrowing or blockages. A renal angiogram, considered the gold standard, involves inserting a catheter into an artery, usually in the groin, and injecting contrast dye to visualize the renal arteries under X-ray. Blood tests to assess kidney function, such as serum creatinine and glomerular filtration rate, are also crucial in evaluating the impact of stenosis on the kidneys. While not strictly categorized into distinct types, renal artery stenosis is generally classified based on its underlying causa: atherosclerotic renal artery stenosis, caused by plaque buildup, and fibromuscular dysplasia, related renal artery stenosis, caused by abnormal cell growth in the artery walls. Understanding the underlying cause is crucial for determining the best course of treatment. Treatment for renal artery stenosis aims to control blood pressure, improve kidney function, and prevent further complications. Medical management typically involves medications to lower blood pressure, such as ACE inhibitors, ARBs, beta blockers, and diuretics. Statins are often prescribed to lower cholesterol levels and prevent further plaque buildup. In some cases, a procedure called renal angioplasty and stenting may be necessary. This involves inserting a balloon catheter into the narrowed artery and inflating it to widen the artery. A stent, a small mesh tube, is then placed to keep the artery open. For fibromuscular dysplasia, angioplasty alone may be sufficient. In rare cases, renal artery bypass surgery may be needed to create a new pathway for blood flow to the kidney. Preventing renal artery stenosis, particularly the atherosclerotic form, involves adopting a heart-healthy lifestyle. This includes maintaining a healthy weight, eating a balanced diet low in saturated fat, cholesterol, and sodium, exercising regularly, and avoiding smoking. Managing underlying conditions such as diabetes and high cholesterol is also crucial. There are no specific preventative measures for fibromuscular dysplasia, as its exact cause remains unknown. However, early diagnosis and management are essential. The prognosis for renal artery stenosis varies depending on the severity of the stenosis, the underlying cause, the presence of other health conditions, and the response to treatment. Early diagnosis and treatment can often improve blood pressure control and preserve kidney function. However, if left untreated, renal artery stenosis can lead to progressive kidney damage, kidney failure, and increased risk of cardiovascular events, such as heart attack and stroke. Ongoing research focuses on developing more effective treatments for renal artery stenosis, including new medications, improved stenting techniques, and genetic studies to better understand the causes of fibromuscular dysplasia. Researchers are also exploring ways to identify individuals at high risk for developing renal artery stenosis to allow for early intervention. Thank you for joining us on this educational journey. We hope this video has provided you with a comprehensive understanding of renal artery stenosis.